going to talk about recurrent lumbar disc herniation. So a recurrent disc herniation is essentially occurrence of another disc herniation at the same level where a patient has already had a discectomy in the past. This can happen in up to 20% of cases after a microdiscectomy. Typically, the patients will improve an improvement initially of their pain and symptoms after the surgery, and at some point, it could be weeks, months after the surgery, they will complain of an acute worsening of the symptoms. So they'll start to have again pain going down their leg, similar to how they used to have it before. There are certain risk factors that we think are possible that predispose patients to having a recurrent disc herniation. This includes smoking, a younger age, or a BMI more than 30. Other risk factors that are a bit more established are heavy or repetitive lifting, large defect in the annular ligament of the disc, as well as patients with diabetes. The imaging modality of choice to diagnose a recurrent disc herniation is an MRI scan with and without contrast. The reason for getting it with and without contrast is really to differentiate a recurrent disc herniation from scar tissue. Now, scar tissue is highly vascular, which means that after in contrast, scar tissue will enhance. So this will light up, whereas a disc herniation will not light up after contrast. And that's why it makes it useful to get an MRI scan with and without contrast to differentiate between scar tissue or recurrent disc herniation. Here's an MRI scan showing an example of a recurrent disc herniation right here. You can see that it appears dark on this MRI scan. And here's an MRI scan of a patient who has essentially scar tissue. So you can see here, this is the image before contrast. And you see it looks like a disc bulge, maybe something going on here. But with contrast now in the second image, all this is still enhancing with the contrast, meaning this is more of a scar tissue and not a recurrent disc herniation. Usually we will also get x-rays in these patients to rule out instability, to make sure that their recurrence of the symptoms is not because of something being unstable.